back. This is Boomer Life on CL 650.
King of Pain, really? That's the song you chose, King of Pain. That's Sting, right? Yeah, it's not Police. There you go. Boomer Life on CL 650. Dwayne, our producer, chose King of Pain. Nicely done. Joining us in studio today is Dr. Hal Brown from the Integrative Naturopathic Medical Center in Vancouver, Broadway, and Granville. Now, we've been teasing about the pain and the issues people have. So you have a pain management program. So what generally does that mean?
Well, I would say what we're really doing is people come with various complaints.
Yeah.
And the program is really to listen to the patient, try to understand the problem, and try to recommend the most appropriate, most effective, most practical treatment.
Yeah. Okay, so I'm a classic example. I have back pain. I haven't had it my entire adult life, and you know, you're a trained chiropractor. I go and see a chiropractor regularly, massage therapist once in a while, and so I get relief from that. But it always seems to come back, and so I walk in to see you, and you know, what would you start with? You know, I have, you know, it's not low back pain, just general back pain.
Well, I would want to hear about. I'd say, well, show me where it hurts you.
Yeah.
Because where you point to will be a factor in trying to understand the problem, and I probably have you go around, have different movements. I'd ask you what makes it worse, what makes it better. Does it happen all the time? Are there activities you can't do? How's your life impacted by this pain? What are the limitations? What are your goals? What would you like to be able to do that you can't do because of this problem? What sort of treatments have you had? I mean, you certainly don't want to reinvent the wheel. There's no point in doing the treatments that have. A lot of things seem really obvious.
Right.
For example, you look at somebody with a tilted pelvis and it hurts there and it hurts this, moving this way, and you think, well, just do an adjustment. That'll probably help. But then you tell me, well, I've been to my chiropractor like every week for a couple of months, and it feels better for an hour, and then it goes back again.
That's me. It feels good for a day, and then the next day I just feel like, oh, I just spent all that money. I can't go back every day, right?
Right. So what you're describing there, now I don't know your case history, and I'm reluctant to diagnose you on the radio.
Okay.
However,
probably not a good idea.
But I'll just give you an example of the way I think about these problems. So, you know, you go to the chiropractor, he gives you an adjustment, you feel really good. Well, the chiropractor did the right thing. He did the chiropractic adjustment that, you know, improved your problem. But the fact that it didn't stay there tells me that there's something underlying the problem. Now, one of the first things I think of, now this isn't a diagnosis, but the first thing I think about is, well, that sounds like instability. Because if the ligaments are too loose and you adjust a vertebrae, it won't stay there. And that's a classic pattern. You get adjustment, feels great, and then it hurts again. Well, then the muscles get tight. Then you go get a massage, and wow, that feels great.
That feels good.
But that's only good for another day.
Yeah.
And you have the best massage therapist in the world doing the best massage. But so why does that work that way? Well, the muscles are trying to hold the vertebrae together.
That's exactly what's happening.
That's right. So, and then they hurt.
Yeah.
And then you get a massage, and that feels terrific.
Yeah.
But then the vertebrae are still loose. They got to get tight again. See, why do core exercises work well for low back pain? Because you're using muscles to stabilize unstable vertebrae.
Right.
Okay, so now I'm starting to think now that maybe your problem might be something like instability. So then I'll ask you something like, tell me, is it worse if you sit for too long?
Is it? No.
Is it?
No.
Is it worse if you stand for too long?
It's just not particular. It doesn't seem to be one thing or the other.
Okay, and if you move around, walk around, do you feel worse or better?
About the same.
Okay. So those are the kind of questions I would ask, and just kind of delve into it, go into your history, when did it first begin, and that sort of thing.
Yeah. And so what if you have somebody comes in with a very specific pain problem? They've been in a car accident. They've been injured. How do you deal with that?
Well, car accidents, the interesting thing about car accidents is that, especially like rear enders,
Mm-hmm.
ICBC likes to say, well, your car wasn't damaged, so how could you be injured?
Right.
And you have somebody sitting there, and they're very anxious, and they're upset, and they're in pain, and they don't have any bruises on them, and they're going, I'm in pain, and nobody believes me.
I had an incident. I was at a stop sign, and a guy behind me tapped the car, like literally just maybe at 1.5 kilometers, 2 kilometers an hour. He was looking one way and didn't realize I hadn't moved forward and banged the back of the car. Well, I got out. There was nothing to either car. I mean, thank you very much. Left. Well, a day later, I woke up and my neck was killing. It was such an insignificant little bump at the stoplight. I didn't even think about it. And then a day or so later, my neck is still sore, and I realized my neck is sore because this guy hit the back of this car at a very low speed. And there was no damage at all to the car, but here I had a sore neck, which eventually went away, and it was fine. But I can see just a very small knock from behind, and when you're not expecting it, can cause problems.
Well, here's the reason why. The cars are designed to collapse in crashes.
Yeah.
But they're designed not to do anything below about, I think maybe about 20 kilometers an hour or so. So if you get hit at low speed, all of the force from the impact goes directly into the car and into your body. But if you're hit from a higher speed, then the car starts to collapse, and the collapse of the car absorbs the shock of the impact. So there's actually more injury in lower speed rear-enders than in higher speed.
Really?
It sounds contradictory.
And then the seat would be able to absorb some of the shock as well. They're designed to especially the new cars with rear-end safety measures. Now, what about sports? Okay, so you have somebody that comes in and he or she has knee pain, but they play basketball or they're a hockey player. And so what kind of thing would you do for somebody who's using their joints more vigorously or muscles more vigorously?
Well, I guess, again, it depends. Was there a specific injury? And usually with sports injuries in younger athletes, usually they can identify when things happened. And then you have to look at, for example, the knee. The most important thing is, where does it hurt? Does it hurt in the front? Does it hurt on the side? Does it hurt inside? Does it hurt underneath the kneecap? Okay? And all of these things give you the first clue about where to look. Then I do the same physical exam. Any doctor should properly do on a knee, and check all the ligaments and the stability and the muscle strength. And basically what I'm looking for is anything I can do to increase the pain a little bit and reproduce the pain. If I can reproduce the pain, then I can pretty well tell you what's causing the problem. And then based on what we find, then I might make recommendations for treatment.
So with somebody who can be off on the sidelines for a shorter period of time, is it a different approach? Are you trying to, they always want to get back quickly for sports people?
Everybody wants to get back quickly.
Human nature.
Nobody comes in and says, I got a year to get this better.
Yeah.
Everybody wants to be better yesterday. If you wanted to be better today, you should have been here 6 months ago.
They don't want to hear that.
No, they don't.
You're a smart aleck. Thanks a lot.
Yeah.
And that's why they take, pain medication, right? Because that gives them the short-term relief that they're looking for. That's
right. And one of the problems is lots of people think that inflammation is a bad thing. So
explain. Okay, I say I roll my ankle, right? And I'm walking my dog, and this happened to my wife, by the way. She's walking along, and she rolled her ankle on the curb, and it all puffed up, and she was, and then we said, well, put ice on it. So explain what the body's trying to do and why ice might not have been the right thing to do.
Well, the problem with ice is that it reduces inflammation. And you're going to say, well, of course, we're trying to reduce the inflammation. No, we want the inflammation. Inflammation is how your body heals. When you injure, like when you twist your ankle, what you're commonly doing is you're overstretching one of the ligaments, or a group of ligaments. Those ligaments are now torn. Okay, so what happens is blood starts rushing in there. That's what inflammation is. Brings in white blood cells, which clean up debris, clean up mess.
Those are the little soldiers that do all the work, right?
That's right. It's just body treats an injury the same as an infection. And so then once, there's a process. It goes on for a couple of days. Then about the third day or so, your body starts bringing in different cells that start causing what we call remodeling or regeneration or regrowth of those tissues.
Mm-hmm.
Okay, and there are chemicals in the blood called growth factors which stimulate regrowth of the ligament. Your body can actually grow back and repair ligament. This is why when we're young, how quickly we can heal.
Yeah.
Because we have a huge healing capability. Now, if you twist your ankle, and you put ice on it, now what you've done is you've constricted the blood vessels, and you've reduced the inflammation. Now, some people might say, well, isn't that what we want to do? Well, no, because inflammation does not cause the pain. Inflammation is healing. Now, there was one of the first sports medicine books written in the 70s by Dr. Gabriel, can't remember his last name, but he coined the acronym RICE, Rest, Ice, Compression, Elevation. I think most people in sports are familiar with that.
Mm-hmm.
And for a generation, every coach has been putting ice on their injured athletes' joints.
Right.
If you go to this doctor's website today, you will see he's made a statement that he was wrong about the ice, that the ice inhibits the inflammation, which inhibits the natural healing process. So we now know that reducing the inflammation is counterproductive, and that goes for anti-inflammatory medications as much as for the ice.
I'll give you a story about spinal adjustments and manipulation. My father, 83 years old now, was of a generation when chiropractic really started to come into the mainstream. It thought it was sort of voodoo, right? And you've heard this, I'm sure, and didn't go for years and years and years. And I've been going to a chiropractor my whole adult life. He has a bad back, and thanks, Dad. and now he goes regularly and gets his spinal. He's like a reformed smoker. He's like the biggest advocate now for going and seeing somebody to help him with his pain. And that's part of your practice, right? You started, your foundation when you started was chiropractic, and sometimes you can have a simple fix for people, right?
Yeah, I think adjustments are great. I still get adjusted regularly myself.
Mm-hmm.
And I think it's a great thing for health in many ways. As we get older too, it's harder to fix things,
Mm-hmm.
and sometimes just managing
it.
The body is actually pretty good.
But you might remember that time back many decades ago where people didn't want to go to a chiropractor, and now it's quite common.
Well, that's when I used to be a chiropractor
Yeah.
in those days.
Yeah.
And I remember when I was at college, I remember reading an article about a chiropractor in Louisiana that was in jail for practicing medicine without a license. That kind of freaked me out.
Mm-hmm.
What am I doing here?
Yeah.
People are telling me I'm going to some freaky, weird, culty thing or something. But, I knew what it was, and I knew what it was, the benefit of it.
It was capable of doing, yeah.
It's interesting to see it all being redeemed today.
Well, we could get him on the phone, and he would agree that now it's made his life a whole lot better.
Mm-hmm.
And so it's and you're probably seeing that now. The average person coming in to see you, they're not opposed to this at all, are they?
Oh, when I started practicing many years ago, it took a lot of educating people to explain what it was about and what adjustments were about and what we were going to do. And it's so interesting that today is people just understand it.
Yeah.
Or if they don't understand it, explaining it only takes a moment.
Right. Well, and the reason I ask you that is because it's the nice lead-in to explaining the next wave of available therapies, regenerative injection therapies, and what that is capable of doing for people who are dealing with pain. And we'll continue our conversation with Dr. Hal Brown from the Integrative Naturopathic Medical Center in Vancouver about managing your pain and getting some relief when we continue next on Boomer Life, right here on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.